Welcome. Thanks for coming. It's a beautiful day outside, but you're here because you want some more information about health and stress and inflammation in general. I'm going to make it worth your while. I'm going to do my best to give you as much information as I can. And it's a pretty important topic. People don't know how much stress and inflammation really affects their health overall. And so some of the symptoms and conditions that can be caused by inflammation and stress are digestive problems, sleep problems, loss of sex drive, erectile dysfunction, anxiety and depression, weight problems, acid reflux, mood swings. And these are conditions that are also very much connected to inflammation and stress: Crohn's disease, type 2 diabetes, heart disease, Alzheimer's disease, ulcerative colitis, rheumatoid arthritis, lupus, and thyroid problems. And this is just a partial list. And we'll go into what inflammation is, what stress is, and how you can do something about it. Okay, let's get started. You heard enough about me. You've met me. You've heard enough about me. We'll move on to the next slide, which is my associate is Dr. Rockenow. She received her undergraduate degree from Skidmore College and her medical degree from Columbia University and Yale Medical School. She completed her medical residency at Columbia. She's board certified in family medicine and anti-aging medicine. She's also certified in the use of Botox and collagen injections. She has over 20 years clinical experience in practice, and her care includes expertise in the areas of physical medicine, anti-aging, natural solutions to pain and female hormonal problems, nutritional counseling and wellness care. Dr. Rockenow, presently a clinical director of medicine in New York at a facility that she's the director of. I'm going to read you this mission statement, and I read this to every audience I ever speak to, and then I'm going to ask you something about it. And you give me any kind of an answer, you win a prize. So, we're a unique multidisciplinary team of professionals dedicated to providing high-quality, effective treatment to reduce pain and suffering in a caring atmosphere. Our goal is to educate our patients, their families, and our community, which you're a part of, on how to sustain a lifetime of optimal health and wellness while limiting the need for drugs and surgery. So, tell me what words in there are the most important to any one of you? What words in there are something to say, wow, I'm glad that he mentioned that, and I'm glad that I'm listening to someone who really, really has that as their mission. Educate, that's a great one. I'm going to give you something that can help you recognize how stressed you are at any time. It's a little card you can carry around with you. It actually measures your body temperature and tells you what level of stress you're in and how you can do something to change that. There's a breathing exercise on that card too. So educate. I love to educate people. That's why I do this. I just think that it's really one of the most important functions of a doctor. And really, some people say the definition of doctor is partially teacher. And if I wouldn't have been a doctor, I would have been a teacher. So I really, really believe that in the old expression that says you can give somebody a fish or you can teach them how to fish. What's better? What's better? Teaching them how to fish. Then they can eat for a lifetime. If you just give them a fish, they're hungry in a few hours afterwards. So I believe that education is really, really important. And what you do with that education is another story. Some people just hear what I say and it goes in one ear and out the other. If you take some action on that education, that really, really can make a change in your life. So I had just fill out a little inflammation, health, and stress survey. And I always ask a question about this. How many people checked off at least one thing on that survey? Okay, you. Anybody else? Yes. How many people checked off 2? Yes. Yes. Okay. How about 3? Okay, I won't go past 3. Okay, I would say that what usually happens is if I have an audience, at least 70% of people check off at least one thing. And what that means is that these things are common. And these are not even the most common problems that people have, but a lot of them are fairly common. And I don't want you to confuse common with normal. These are not normal. These are really signs of your body saying something's wrong. I'm going to give you a little kind of warning that something is wrong, and it's up to you what you do about it. So you have choices. So we'll talk about that. And So what is health? What's your definition of health? What does being healthy mean to you? You win a prize for this one too.
Wake up in the morning.
Okay, well, that's kind of a low bar. I'm going to try and raise your bar up a little bit because I think it's really much more than that. The way you feel physically. Okay, I'm going to give you a little gift also. And this is a pain relieving gel that has no side effects and it works very, very well. It doesn't fix your pain, but it really makes you feel better, at least temporarily, without any side effects. It has natural anti-inflammatory properties. So we had two answers. One is how you feel physically. Another one is if you wake up, you're doing okay. If you're on the right side of the grass, okay. So I'm going to tell you what the definition of health is, actually. Health is a state of optimum, as good as you can be. Now, everybody's a little bit different. Not everybody's going to be an Olympic athlete, but really, you can really raise your level of health by doing certain things. The way you live your life really has a great influence on what your health actually becomes. Health is a state of optimum mental, physical, and social well-being, not merely the absence of disease. So what's the definition of insanity? Anybody know it? Opposite of sane. That's a good answer. Well, it really means that you're doing the same thing over and over and over again, and you expect to get a different result. That's what insanity is. And so I'm going to talk to you about maybe thinking about your health a little bit differently today. And I want to help you be as healthy as you possibly can be, or at least kind of get an idea of how you can do that. I can't fix all of your health problems today, but I can at least inspire you to have an idea of what you can do about your health in order to improve it. Okay. Today you have two choices regarding your health. You can do the same things you're doing, getting the same results, or you can try something new, do something different, and get a different result. If I could show you today how to get rid of your problems by doing something natural and affordable, would you do it? Raise your hands if you would. So who's at least open-minded enough to do something different? Good. Okay. So what we'll cover today is America's healthcare crisis. In spite of how much money we spend on healthcare in this country, we spend more money than any other country in the world. Our health statistics are not very good. And this is really, for a long time now, they've actually been getting a little bit worse. The underlying cause can be stress and inflammation. How to take action to protect your health naturally. Those are the main things we're going to cover today. This presentation is for you. If you're feeling a little overwhelmed with life or exhausted, not as much energy as you'd like, you're not feeling as good as you know you should, you know you've got to do things differently, but you don't know how. Does that sound like any of you? Yes? Yes? Okay. It's all about you. This presentation is all about you. It's about giving you some thoughts and tools that you can use to help yourself, and then maybe giving you an opportunity to get some more information if you'd like at the end. Okay. So today, our modern lifestyle is driving so much hidden inflammation that leads to almost every known disease of aging. The ones I mentioned before: heart disease, cancer, diabetes, Alzheimer's, depression, autoimmune diseases, allergies, asthma, and gut problems. So what we're saying is that for a long time, we know that inflammation is really, really in our bodies quietly. And really, inflammation, most people relate to inflammation. They say, oh, if you bang into something, your arm might get swollen, a little red, painful. That's the obvious form of inflammation. But hidden inflammation is quiet. It's hard to detect. There's some tests that I'm going to talk about that can really help you detect that, and really help a doctor who's trained to look for these things, that this might be the cause of some of your health problems. What is inflammation? There's hidden inflammation, systemic inflammation, chronic inflammation, and silent inflammation. Inflammation isn't just there randomly. It's there because there's something causing it. So that's important too. Inflammation is a silent killer. It turns out it isn't the type of inflammation you're familiar with, like a sprained ankle or sore throat. Both of these are examples of good inflammation. We want to know when we have a sprained ankle. We want to take care of it. We want to know when we have a sore throat, do something about that. But the hidden inflammation sometimes doesn't really become obvious until It's been there for a while. And even then, it's difficult to detect. What is stress? Stress is the body's reaction to any change that requires an adjustment or a response. The body reacts to these changes with physical, mental, and emotional responses. Stress is a normal part of life. You can experience stress from your environment, your body, and even your thoughts. So there's mental, chemical, and physical stress. Stress affects lots of things. It can affect your brain and nerves, your heart, your stomach, your pancreas, intestines, reproductive organs, and even skin problems can be affected by stress. The three major categories of stress are mental, chemical, and physical. I had a very, very smart doctor, very, very world-renowned, and he said, you know, when patients come into your office and they are telling you about a complaint, giving you one of their complaints about something's bothering them, think about all of these three areas as being sometimes a combination of them that's causing the problem. It isn't just one thing. It's not that simple. So I've always thought about that. And I think if you really want to get rid of the cause, you have to think about these things. What's causing the problem? Not just what the problem is. I'll talk more about that. It's the difference between healthcare and sick care. We're going to talk about that also. Stress is part of life. It's necessary for survival. It's what's called the fight or flight mechanism. Have you heard of that? You know, in prehistoric times, all we had to worry about is we'd live in a cave. We'd come out of the cave when we were hungry. We'd look around for tigers and lions and, you know, other predators, and we'd look for food. That was our major stressor, to actually stay alive and look for food. Totally different nowadays. Stress today is chronic. That means it's hard to get away from it. It's in our environment. It's on the news. It's when you look at a computer. It's the way your work environment is, as you were telling me. It's sometimes a lot to do in your family environment. Sometimes that can be very, very stressful. Financial situations can be stressful. So all of those things are different than what prehistoric man had to deal with. And that's really where our stress reaction came from. It's ingrained in our evolution. And nowadays, we don't really have to deal with those really terrible things like staying alive if we have to, you know, fight off predators, or food is somewhat plentiful for most of us. We don't have to hunt and gather food, but we still have a lot of stress in our lives, and our body still reacts to that stress the way it used to when there was a lion or tiger out there. Does everybody understand that? You have the same reaction because you're really trying to survive. It's really a survival mechanism. Anybody ever hear of the term functional medicine? Okay, so I'm going to give you a definition of it. It's optimizing health and improving function to prevent and reverse disease. Our bodies were designed to be healthy. How do I know that? Well, if you pay attention to what your body's capable of doing without you thinking about it, without you taking a pill for it, without you putting a Band-Aid on something, things heal on their own for the most part. Your body has tremendous healing mechanisms built in. Oh, just like a cut. If you cut yourself, is it the Band-Aid that heals the cut? Is it the antibiotic ointment that you put on it that heals the cut? Or is it your body's own healing mechanism that does it? I think it's pretty obvious that it's not the Band-Aid. If you don't rub dirt in it, it does pretty well. So I'd say, so you have to give that due respect that your body has the ability to heal itself. So the functional medicine approach is to identify and address the cause. And this is a really, really important point. The root cause of any disease or symptom. It's not the what. In other words, not just putting a name on it and then giving you a pill for it. It's why. That's the difference between the way I practice and really the way traditional medicine has been practicing for years now. The body can heal and defend itself against all types of problems if the cause is removed and not just covered up. You should add a functional medicine specialist to your healthcare team. I don't want to replace your doctor. I want to be an addition to your doctor. I want to add things that they're not looking for or doing for you. If you really give a functional medicine doctor a chance. I care about why you're inflamed. I don't want to give you an immune suppressant, an anti-inflammatory drug, or a pile of aspirin. I want to find out the cause and remove it through functional medicine. To understand what I'm talking about, let me show you a simple rule. It's called the TAC rule. Okay? The TAC rule. If you're standing on a TAC takes a lot of aspirin to make you feel better. That makes sense? Okay. Or if you have a pebble in your shoe, it also would take a lot of medication to make you not feel it. The best approach is take out the tack or take out the pebble. You get rid of the cause. Think about it. How many times are you just covering up problems instead of getting rid of the cause? If you're standing on two tacks, removing one doesn't make you 50% better. You have to remove both of them. You'll feel 100% better. The secret of functional medicine is sometimes you may have 5 to 10 tacks, but if you remove all of them, you will feel better and really stay healthier. So let me give you an example. Anybody ever get headaches? Think about it. Yes? Ever? Raise your hand. Always. A lot of you. Okay, so when you get a headache, what do you do? What do you do? Sometimes you wait. Okay. Oh, okay. 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 Do they come? Okay. Well, I think there's all, I really also believe there's many ways to fix the same problem. Sometimes just waiting, that's one. But does it waiting or taking Advil, does that give you less of a chance of getting a migraine again? Does it, so think about that. You're really, to a large degree, covering it up temporarily. And then all of a sudden, that mental, chemical, and physical stress builds up for some reason to the point where you start to get a symptom like a migraine again. So the ideal thing is, why are you getting the migraines? Has anybody ever given you any explanation for that? No. Okay. So that's what I look at, and with every problem. I can't say I fix everybody, but I help lots of people get rid of why they have problems and not just cover them up. Okay, that's good. Yeah, you don't want them too often. You want them as little as possible. So another example, I guess, let's say if you didn't have migraines and you had what we call the stress headache or a muscle tension headache, and you took something for that. Think about this. Did you get the headache because, let's say you take Advil or Aleve or something like that. So I have at times also. As a matter of fact, I have a history of having migraines, but I don't get them anymore because I got rid of the cause. I'll tell you a little bit about that story too. So I was in professional school studying to be a doctor, and we had guest speakers come in all the time who were part of our course material. One was a PhD in biochemistry, and he was the father of functional medicine, the first doctor who thought that maybe there's a way to get people healthier without medication or as an alternative to medication or maybe in addition to medication, but not making medication the primary way to get people better. He had an incredible memory. Anything he read, he remembered perfectly. He could recite all the abstracts that he ever read. He was a pretty amazing person. His name was Dr. Jeffrey Bland, and he was the father of functional medicine. At that time, I was in school, highly stressed, drinking coffee, living on SpaghettiOs, because I had no money. It was SpaghettiOs and Kraft macaroni and cheese was my main diet. And I never had headaches before. And all of a sudden, the stress of school, staying up at night, living on this kind of food, I got migraines. And I said, oh my God, I went to a couple of doctors that, said, take this, take that, take this, take that. And then I spoke to Dr. Bland. And he said, I think it's a combination of things. It's stress, but it's also your poor diet. The poor diet is playing a big part in it. And when I improved my diet, I never had migraines again. This was 45 years ago. So got rid of the cause. Okay. This is an article that was written over 30 years ago in Time magazine. And this is not my cover. This is their cover. The Secret Killer, the surprising link 35 years ago between inflammation and heart attacks, cancer, Alzheimer's, and other diseases. What you can do to fight it. And they had some suggestions then, but they weren't about medication. They were trying to get rid of inflammation and what was causing the inflammation and advising people to do things like that. And we still don't really use the information that was available at that time. And I'll tell you why to a large extent. So this just shows you the foods that cause inflammation and the foods that fight inflammation. Some people are very, very, well, everybody's unique. Some people have very, very unique sensitivities. And that's one of the things I may test for sometimes is what things are you particularly sensitive to and causing lots of your symptoms that are leading to or that are caused by inflammation. What's the problem with common treatments? Why can't I just take Advil or aspirin? You can. They're perfectly fine for acute short-term problems. The issue arises when the problem doesn't resolve, when the inflammation persists, they don't really work long-term. Your problems come back because you're just doing something temporary. It's kind of like if you're driving a car and the engine light goes on. Anybody ever have that happen? Or some light goes on the dashboard. So taking an aspirin, in my mind, or a medication for a problem, if it's not really fixing the cause of the problem, it's like putting black tape over the light that goes on your dashboard. Anybody do that? Like if the car lights up, you put black tape on it? No. You usually take it to someone who's going to diagnose it and really, really fix the problem. He's not going to put black tape on it. He's going to see what's wrong, get rid of the cause, and then you don't have the light anymore because he fixed the cause. Everybody get it? That's a different story than covering something up. Okay, what reduces inflammation? Exercise, diet, whole refined, unrefined, unprocessed foods. Refined and processed foods make up 60% of the calories in our diet, and I'm going to talk a little bit about what those are. You want to reduce inflammation by lowering your consumption of sugar and starch. What do you think the most inflammatory food is in our diets? I gave you a hint. I just read it to you. Number one. Number one. You know how much sugar the average American consumes a year in pounds? Take a guess. 150 pounds per year. On the average, 3 pounds a week. And in 1900, we measured it, there was a half a pound a year. Half a pound compared to 150 pounds. 300 times the amount that we had in the year 1900. And our diseases reflect that. The diseases that we are dying from now were not the same as the diseases that people were dying from in 1900 or the ones that they were contracting. So the change in diet, the change in the environment, the toxins and artificial things that are in our diet and in our air and in our water and in our personal products are all causing inflammation that causes this hidden problem that we really don't connect with our illnesses, and our doctors don't look for those things for the most part. Yes. Yeah. Yeah, absolutely. It's absolutely true. Yeah, you really want to try and avoid all of the plastics that are contacting your food as much as possible. You want to switch to glass and yeah, you want to switch to glass or stainless steel. And you want to try to avoid putting anything plastic in a microwave, trying to maybe even stay away from microwaves as much as you can. So that really improves your health because you're not putting these poisons in your system unnecessarily. Sometimes we can't avoid them, but if you can avoid them, you're much better off. No trans fats. Those are the most unhealthy fats that have been mostly removed from foods, but they're still in our foods. No refined oils. You know what refined oils are? Okay, refined oils are anything made from oil from vegetables, corn oil, cottonseed oil, safflower oil, sunflower oil, any type, canola oil, all olive oil is a good one. Okay, yeah, yeah. If you really limit your oils to olive oil and avocado oil, you're doing really well. But anytime, if you look at the ingredients in almost anything that comes in a package, it will not be olive oil or avocado oil if they're using any oils at all. Why? Because they're cheaper. They really don't want to spend extra money on ingredients if you're not going to notice a tremendous difference in taste. You want to actually learn some things. Hi, nice to have you here. Yeah. Yeah, better. Cold pressed extra virgin olive oil. I can go into it even in more detail. Olive oil that comes from one source. The olive oil that comes from a number of different countries, you're a little bit unsure of how it was made. And so ideally, but it is more expensive, but it is much healthier overall. And it has benefits. And you know, you've heard of the Mediterranean diet. Well, people who follow that diet use a lot of olive oil, and they have better health than we do in our country. We have a lot of things that we're exposed to that they aren't exposed to. Meditation and yoga, those are types of relaxation, deep breathing, massages. Those are all things. How many people have some stress in their life or have had it? Everybody. I have, you have, everybody has. So I have a principle. The more stress that you're exposed to or have been exposed to, and maybe even still suffering from the effects of that stress, the more healthy things you have to do. And what do most people do when they're under stress? What kind of habits do they have when they're under stress? They eat more, and they usually don't eat the good stuff, not the good stuff. They also sleep less, they worry more, they don't exercise as much. They do all of the bad habits that just aggravate the problems of inflammation. They don't give your body a chance to heal itself. So the more they drink more, they smoke more, they have those things as habits. So every time you're under stress, you know what you should do more of? Relaxation, okay? Exercise, eat better. You'll recover faster. You won't cause all the harmful effects of stress. But it takes sometimes a habit. You have to actually develop a habit, and sometimes you need a coach to coach you through the things that you need to do in order to relieve the harmful effects of stress and inflammation. Which ones do you have? Take a look at these, and I would say, anybody have any of these on as part of their health problems? Anybody? Don't be afraid if you don't want to. Okay. Blood sugar problems? Yeah. They're very common. 30% of the population are pre-diabetic or diabetic. It's an epidemic. What do you think it's caused by? Well, refined carbohydrates in our diet and lack of exercise. It's a very preventable disease. Instead, what's the solution that medicine is giving people for diabetics? Medicine. Talk more about that. Okay. The doctors are not thinking about the root causes of disease. They usually focus on what's your symptom. Tell me what you're feeling. They think, let me find the drug that best matches that symptom. Pain, pain reliever. Depression, antidepressant. All of those things are very, very simple solutions to a more complicated problem and not getting rid of the cause. Mostly are just managing symptoms. Pills for every ill. I mean, if you go to the doctor nowadays and you do complain about something and you have something that they want to treat, they have a certain toolbox. What's their toolbox? Medication. Yeah, prescription bed, right. You know, if all you have is a hammer, everything looks like a nail. Okay, so it's really pretty much the case. And why is, and you know, you told me your daughter is a pediatrician, and I love doctors, and I have very, very close friends that are medical doctors. And I would say all of us care about people very much, but their training is geared towards this. This is their training, and maybe your daughter tells you that, or maybe you never ask her. But really, if you ask her how many hours were spent on alternatives to medication as a way to help people, she'll say very little. It's really under 10 hours for the entire education she had. I've had many, many medical doctors work with me. One I remember worked with me for a couple of years. And one day he stopped me in the hall. He said, Ed, I've been here for a couple of years, and he was trained in Yale. He had a wonderful, medical education, very bright guy. He said, Ed, I used to work in an internist's office with 9 other internists that were just like me. And I was just like them. For the problems that people brought in, we all prescribed medication. He said, since I've been working in this multidisciplinary facility that has lots of different things besides medication as a solution, he said, I prescribe 1/10 of the medication that I used to prescribe for the same problem. Well, think about that. It really is possible that 90% of the medication that people are having prescribed for them, there's an alternative. There's another way to treat these problems without side effects. That's what I found in 40 years of practice. And he didn't know anything about exercise, really, not to be able to guide people better, or diet and nutrition, or relaxation, or acupuncture, which I also am trained in. He didn't know anything about those things, nothing. He knew about medication, and I didn't know as much as him about medication. That was his tool. And if you're a surgeon, your tool is surgery also, in addition to that. I've helped thousands of people avoid unnecessary surgery and unnecessary medication. I treated over 20,000 patients in my 40-year career. Okay. Frustrated taking a pill for every ill? Our team will get to the root cause of the problem to help you live your best life. Is there anybody here who's feeling their best? They think they're feeling their best. Could be better. Yes? I mean, well, could be. Better than just getting up in the morning, better than just being able to breathe. There's really a whole nother level of what you might be putting up with that you don't have to put up with. And you could actually find ways to solve that and make your health better. Has anybody heard of the blue zones? No? Maybe? Blue zones are 5 areas of the world where people are living to be, more people in those zones are living to be 100 without chronic disease. That's what they've discovered. And they have a few things in common. What do you think they are? Diet is number one. What do you think? What else do you think? They move. Movement is part of their daily life. They don't even have to go to a gym. They just, they're herding sheep, and they're farming, and they're planting, and they're doing yoga, and they're doing, Tai Chi, and all sorts of movement exercises. That's part of their life. They've been taught that from generation to generation. They also are very social usually. They're not living alone. They have a family around them. Very important too. Those are the common threads. Nothing really complicated. And that's what that's where health comes from. Lifestyle habits and the things that really affect our life and our health more than anything. That's what we know. Heart disease used to be looked at as a plumbing problem. It means clogged arteries. We now know it's an inflammation problem. The reason cholesterol becomes an issue is because the arteries become inflamed, and white blood cells scoop up the cholesterol and stick it to the arteries, creating plaque. Same thing happens in the brain with Alzheimer's. It's simply an inflammation of the brain. Cancer is also a disease of inflammation. So treatment is a choice. We can give people a statin drug for their cholesterol, or we can get rid of the inflammation and change their diets, and they won't need the statin and all the side effects of that. Same thing with Alzheimer's. There's been no medication. There's been about 400 trials for medications for Alzheimer's. There hasn't been one effective treatment for it, medication-wise. If you change your lifestyle, I'm not saying we can cure Alzheimer's, but we can slow it down, make it less aggressive, and the earlier you do it, the better. Cancer, the same thing. Our success rate with certain cancers is pretty good, but really, overall, we haven't made a tremendous change in that either, with all of the billions of dollars in research that's been done. Okay. These pictures of people tell me sometimes what area of the body is being affected. So a body like this with hip and belly fat is very, much related to hormonal problems. A body like this with upper body adipose tissue and belly fat, very much related to stress-related problems. This looks more like overall fat deposited, that's thyroid. And this with the protruding belly can be a liver problem. I'm not saying it's strictly that, but it gives us a little clue. So hormones, fatigue, and belly fat. So inflammation, stress, anxiety causes belly fat and hormonal imbalances, sleep trouble, fatigue, poor memory, and digestive issues. Now, should you give people a medication for this, for this, for this, for this, for this, and this, or should you fix this? What makes more sense? I want it to make sense to you. I'm not trying to convince you of anything, but usually, and you don't see this on television. I mean, what do you see on television? Every other commercial is about medication. And it's working. It works really well. People go to their doctor and say, I saw this. And I say, do you think this could help me? And he'll write you a prescription, or she will. And that's a perpetuation of brainwashing that our our population is getting. And so it happens every single day, and they're spending billions on it. I mean, there's no youngsters here except this guy here. So I would say, if you remember, 25 to 30 years ago, there were no commercials on TV for medication. You remember that? Yes, yes. They were not legal. They couldn't put a commercial on medication on television. And then the pharmaceutical industry started to lobby Congress heavily, and they're still the #1 lobbyist in the world for changing what Congress wants to pass as a law. And what they said was, if we tell people about the side effects, can we put the commercials on TV? And they said, yeah, we'll be okay with that. And before that, the only way that a doctor really learned about medication, or patients learned about medication, was the doctor had pharmaceutical agents come to his office, buy him lunch, and then they would educate him, or he learned about it in journals and abstracts. But the public was never bombarded with commercials, never. Now that's not the case, and the industry has grown tremendously. Does it mean it's better for our health? I don't think so. I know it's not. The statistics say it's not. So some of these are common problems that are also treated with medication: insomnia, depression, irritation, and these are all things that I've helped without medication. Strategy to reduce the harmful effects of stress and inflammation. Sleep is another big factor. Anybody here have any problems with sleep? Be honest. And I'm going to tell you what a problem with sleep is. If you're sleeping less than 7 hours a night, and you're waking up at night and you're not getting back to sleep easily, and you're not getting up in the morning feeling like you had a good night's sleep, you've got a sleep problem. Sleep, anybody here who wants to age faster? Anybody here who wants to age slower? All should raise your hand. You want to age slower? Fix your sleep problem. Your body needs to repair itself. It needs the time to do it. It's like we call in the cleaning crew at night, and that's when your body actually gets a chance to repair some of the things that got damaged during the day. If you don't sleep well, you don't get a chance to call in the cleaning crew. So don't ignore it. And bad sleep is not caused by a deficiency of Tylenol PM or red wine or vodka or scotch or Ambien or Lunesta. Those are not the reasons why you're not sleeping well, not because you don't have enough of that. And if you have too much of it, it could be the cause of your sleep problem. But you want to find out why. Sometimes it's a hormonal imbalance, and sometimes stress related. If you're stressed a lot during the day or have been, there's a hormone called cortisol. Cortisol, has everybody heard of that? Cortisol really controls your sleepfulness and your wakefulness. It's supposed to be high in the morning so that you get really awake, and it's supposed to be low at night so you can go to sleep. When people have a lot of stress in their lives during the day, then the cortisol level gets high, stays high at night, doesn't allow them to sleep well. And so again, covering it up doesn't fix it. Get rid of the cause. There's a test that I do that's really very, very, very helpful, and it tests your cortisol level throughout the day. And most doctors never do that test, ever. Very rare. And it's because there's no medication approach to help it. So if they don't have the answer, why do the test? Okay, so missing pieces. So one important piece is having somebody that can teach you how to use what I'm telling you. Number 2, fitness, getting in better condition, shape overall with exercise and with diet, nutrition, fixing the stress and hormones that may be out of balance. And I call it a detox, or just like a cleansing. You know, we eat so much junk and get exposed to so much junk. You cannot believe how well you could feel within a few weeks of getting rid of those things. It's amazing. It's miraculous in my office every day. I had a patient the other day who every day he would need to take about 2 or 3 naps. And he's in his 50s, very, very fit. He actually won a medal for being a Peloton, excelled at Peloton exercise. And he's still tired every day, didn't sleep well, had mood changes, had irritability. And 1 week of taking away all the foods that were inflammatory that he was putting into his system, he said he hadn't felt this good in 20 years. 1 week. That's how it could change. And so if you continue to do what you're doing, you'll never get that opportunity. You have to do something different, something that you have no clue could help you. But I'm telling you, it can be miraculous. So treat the whole person. You know, we have a system now where we take our brain to one doctor, we take our foot to another doctor, we take our liver to another doctor, we take our kidney to another doctor, we take our heart to another doctor. And those doctors don't really talk to each other very much, and they don't really know what they're each doing very much. To a certain degree, they do, but they also are not looking at how everything is connected. Why do people have all of these symptoms where they need to go to all of these doctors? I'm telling you, one of the common threads is inflammation and stress. Two of the common threads. Nutrition. The purpose of food is to sustain life, provide energy, and to promote the repair of tissues. So this is, you know what the SAD diet stands for? SAD. Standard American Diet. That's the SAD diet. That's what we have here. And it's something that leads to all of these problems. Again, do we need to treat all of these, or do we need to get rid of the SAD diet? Mentoring. Everybody needs a mentor or a coach in life. The more you find the right people, they can steer you tremendously well and help you tremendously. I love sports. I love basketball, especially. Anybody know Michael Jordan? Okay. So I use him as an example. He was a great, great athlete, and he got into the NBA. He was pretty young, and he was great individually, but he wasn't successful winning championships. All of a sudden, Phil Jackson, I don't know if you know anything about basketball, became his coach, and he won 6 championships after that. So was it him being different, or was it him getting a great coach? What do you think? You know the answer. Great coach. Same thing with your health. You need a great coach, a great mentor. These are some of the tests that I order, and some of them are similar to what your doctor may order. But the other thing that's important is test results should be optimal, not just normal. So let's say, for example, vitamin D. 40% of the population is deficient in vitamin D. The other 60% is somewhere within the normal range, but if they're not in the optimal range, they're still not being as healthy as possible. So the range of optimal is 95% of the population. It's an average. If you take 100 people with vitamin and take their vitamin D levels, if not 95% of them will fall within certain numbers, actually between 30 and 100. And if you're not outside the 100 or below the 30, your doctor says, you're normal. And you say, I don't feel well. I get colds and flus and infections all the time. My bone density is low. He says, but you're in the normal level for vitamin D. But are you in the optimal level? That's what I look at. I want you to be in the optimal level. You know what? You understand the difference? Okay. Being in the optimal level is really where you want to be for any of these problems. Another test that's really important is called HSCRP. It's an indicator of inflammation. If it's very high, it's usually an infection, but it's kind of in that mid-range where it's kind of higher than it should be. Below 1 is actually ideal. Anything between 1 and 10, you start to say, could be hidden inflammation. That's part of this person's problem. Just an example of how I look at a blood test versus how a traditional doctor will look at it. Okay. Can you change the future of your health? You can. Get excited. You could change it. Order the correct test. Determine the true underlying cause. Focus on the cause and not the symptoms. Correct the dysfunction, not alter the labs with drugs. So people will say, I have high blood pressure, but I'm on medication. So they don't consider themselves still having high blood pressure. They're diabetic and they're on medication. I consider them non-diabetic and not having high blood pressure when they have normal blood pressure and normal blood sugar without medication. Medication is just controlling your problem. It's not curing it. It's controlling it. And who benefits from that? You do, just because the numbers look better. But the pharmaceutical companies want to create drugs that control your problem. Why? Because then they can keep you on them for life. They don't want to cure it. They don't. It doesn't make sense economically. Address the body as a whole. You need a systematic approach and a mentor to teach you. How do I know if I have inflammation? One of the most common things, I just talked about this, C-reactive protein. Food sensitivities, I'm not going to go into this in detail, but there is a test that I use sometimes, and sometimes it's just a food elimination diet. Here, stay away from all these things. Let's see how you feel. And then maybe if you feel a lot better, then maybe we'll reintroduce one thing at a time. But some foods are much more common. Like these are the most common food sensitivities: milk and dairy products, citrus fruits, eggs, foods containing wheat and gluten, corn, sugar, coloring additives. Almost everybody's eating a lot of those things. And you don't know how much they're affecting your health until somebody says, let's do a controlled elimination diet, do a test, and oh my God, you could feel so much better. Okay. The adrenal glands are very important for regarding stress, and sometimes I do a test called the Adrenal Stress Index test. It's an at-home saliva test, which is exactly what you want. Sorry, I hit the wrong button. Okay. It measures chemical messenger production throughout an entire day. So when you go get a blood test, boom, they take your blood, send it away to the lab. That's one moment in time. This is a test that measures how your chemical messengers are throughout the day. It's superior to blood tests for assessing daily hormonal balance. Why didn't my doctor tell me about this? Well, the simple answer is it isn't part of their training, and it's not part of how they can treat people. Why? Because most are trained to prescribe medication, and this approach takes more than that. If we find out something's wrong with this test, we have to coach you about eating properly, exercising properly, changing your habits, and then we get rid of the cause, and you don't need the medication. In order to get a different result, you have to do something different. This is a simple little picture that shows you that most doctors spend their time, we call it up here, in the branches. Everybody get it? All of these things are symptoms: digestive problems, fatigue, depression, anxiety, hormone problems, chronic pain. This is what brings people to the office. I got one of these things. And he's looking at, what can I give them to fix these symptoms? But what they should be looking at is down here in the roots, the root cause. What is causing all of these things, or some of them? And understand the difference. It doesn't mean that I'm right and traditional medicine is wrong. It's just there could be many ways to fix the same problem. Which one do you want to choose? The ASI test looks at several other factors: inflammation, digestive function, hormone balance, infections, and more. You're never going to get this test from your doctor if he's a primary care doctor or even a specialist. They just don't do it. So one of the primary reasons many good approaches fail is because they're incomplete. Like a puzzle piece that's missing. Just like a splinter, if you don't take the whole thing out, it still hurts and it gets infected, right? So I'm going to read you a testimonial of one of my patients. We're almost done. I began care as a 65-year-old female patient of Dr. Markowitz at Advanced Wellness and Injury Center. My symptoms were initially fatigue, hot flashes, night sweats, difficulty staying asleep, mood swings, vaginal dryness, repeated urinary tract infections, and pain. My symptoms improved tremendously in an 8-week period with Dr. Markowitz and the center's comprehensive approach, including a hormonally balancing diet, supplements from my adrenal glands, a supplement to enhance my immunity, a bioidentical cream based on blood testing, and stress-reducing activities such as yoga, exercise, and meditation. Included in my care were health-enhancing treatments of massage, electrical acupuncture, and manual therapy. So this is the example of results of conservative treatment. This is what's possible. Not one medication was used for all those symptoms. Okay. Dr. Markowitz's help with Crohn's disease. I had a patient who was in his 20s, and he was actually the son of one of my other patients. So this is what his story is. 4 years ago, and Crohn's disease is supposedly an incurable, progressive, inflammatory disease. And the only way to fix it, he said, he was told. He was a coach of a soccer team. He had to go to the bathroom hurt so badly. I knew something was wrong. I called my mom, went to the hospital. At the hospital, they ran some tests, ordered a colonoscopy. I was seen by a GI doctor at the hospital and two others that said the same thing. The only options for treating Crohn's disease were steroids and immune suppressing drugs. And if they stopped working, I might need surgery for my colon. That's what he was told immediately after the test at the hospital. I was referred to Dr. Markowitz, who worked out a plan that did not involve medication. I told him I was willing to give it a try, but if it didn't work, I'd try the medication. Dr. Markowitz mentioned he had helped many people with Crohn's disease by reducing the harmful effects of stress and foods that were making the disease worse. He suggested a food sensitivity test to determine which foods I was most sensitive to. I began treatment by avoiding these foods, and gradually I was able to return to many of them with my diet. 4 years later, I feel healthy, back to my old self. I was a happy and very positive person before I got sick with Crohn's, and I am one again, where I don't have to worry every 5 seconds, where's the bathroom? If it wasn't for Dr. Markowitz, I'd be on the medication, because every GI doctor who's trained similarly, you understand, he was on a merry-go-round between one GI doctor and another, told me that that was the only route. If they were wrong, Dr. Markowitz was amazing and has really helped me. I wouldn't be where I am today without this guidance. And these are just a couple of stories that I thought are pretty informative and really let you know what's possible. So stop procrastinating. If I tell you you need to do something different, maybe you need to do something different. Don't keep waiting until it gets worse. Don't procrastinate. Don't wait until you have symptoms that maybe are very difficult to fix with conservative care, although it's amazing what you can fix. So this is the medical merry-go-round. They don't remove the cause. You go from one care provider to another, one specialist to another, and you're just on a ride that goes round and round and round. This is different. This is where we try to find the cause of the problem. It's a different tool bag. We remove the cause. These are some of the things, some of the specialists in alternative care that can help tremendously. You got to get off the ride you're on if you're not feeling as good as you should. And if you've been told, it's everything we can do, just like my patient with Crohn's disease, this is all we can do. That's not true if you stay on the same merry-go-round ride. Does everybody understand that? There's a different ride out there that you maybe have never experienced. I'd like to end this program by offering you a gift. And I do this for a number of reasons. First of all, I love helping people. I get a personal joy and satisfaction. I've been doing it for over 40 years. I love helping people. I love changing people's health, even if they come to me with severe problems and they're so amazed at what can be done. So these are some of the things that our office: functional medicine, chiropractic, physical therapy, acupuncture, massage, nutritional counseling, pain management, occupational health. And the combination of these things are what we use to help people. I'm also a member of an organization, a nonprofit organization. It's called the Foundation of Wellness Professionals. There's over 1,000 of us in the country. We provide 30 educational workshops on natural health per year. We have to. That's our obligation. So that's why I do this. I want to stay a member of this community and this organization. And then obligation number 2 is to invite attendees of those workshops for an educational visit to our wellness center to determine if natural solutions can be utilized to solve their problems. So if you want some more information, let's say at least I've sparked some interest, that maybe you want to look further, ask me some questions. Everybody here and everybody on the Zoom call also is entitled to what I call a discovery call. And it's where what we'll discuss is what you've already done to help yourself, what you've tried, what has worked and what hasn't worked, what your health goals are, both in the short and long term. What questions do you have? And if it's determined that we're a good fit, you'll have another opportunity to go further. But this is totally free. And all you have to do is tell me, and we'll schedule a time for you. We can do that today. And if you're on the Zoom call, if you're watching on Zoom, this is our number, 203-798-WELL. And you can call that number to schedule your discovery call. And just call my office, and that's our office number. Number 2, if after the discovery call, I say, boy, this is a good candidate for what we do. And I don't take everybody. There are people that I tell them to go find them the best specialist or another doctor who I think is going to help them more. But you'll have the opportunity to schedule a 60-minute comprehensive consultation and screening valued at $395 for a cost of $95 because you came to this talk or you're listening on Zoom. And I'll tell you what that consultation involves. And it's, when's the last time a doctor spent an hour with you? And that's what it takes to really investigate what's wrong. You can't do it in a 15-minute visit. What's the average visit that you've had with the doctor? Usually between 7 and 15 minutes. Doesn't take that long to write a prescription, but it takes a lot longer to figure out what the cause is. It takes more time. So we want to make sure that we know what's wrong and give you a plan to help you. So the 1-hour consultation evaluation will include a screening test for stress, a computerized postural evaluation, testing for undetected nerve damage, diary review. That's where we look at what you put down for your diet, measurement the percentage of body fat to tell you how much extra fat you're carrying around. You know that every cell that is a fat cell is a hormone factory, a bad hormone factory, not a good one. It's not making the good hormones, it's making the bad ones. So the more of those that you can reduce in size, the less bad hormones will be circulating in your body, causing inflammation. So weight is a big factor. Computerized foot scan and a customized plan to address your health concerns, including the cost. So this is what you get if we decided to call, you're a candidate for our office, you're a good fit, and it's $95 to do that. And then you'll know at the end of this visit what we would do, what it would cost. It's a sick care model that we have here in the United States. It's not a healthcare model. It's not a model that makes you healthier. It's a model that actually just treats you when you're sick and doesn't teach you how not to be sick. This is Medicare. People say, oh, well, is your treatment covered by insurance? This is what Medicare tells the doctors. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. So most people are guided, and most doctors, unfortunately, are guided by what's covered by insurance. Insurance companies really don't want to keep you healthy. They want to actually increase your premiums on a regular basis by keeping you ill. I hate to say it, but that's true. So don't be dictated to about your health by what insurance covers. This is the ladder of health. If you want to go up the ladder, I'll help you. I help you go up the ladder. So pain and disease starts here. Healthy eating, improved sleep, pain reduction, stress reduction, ideal weight, regular exercise. You can get up there. The bad habits that we have to get rid of is poor diet, minimal exercise, poor sleep, high stress, poor posture, extra weight. That's the formula. You need a good coach, a great coach, somebody who has a lot of experience helping people this way. Don't wait until it's too late. This is a high-stress businessman with diabetes, cardiac issues, overweight, and he waited too long. So he wound up having a heart attack. The greatest medicine of all is to teach people how not to need it. Think about that. So you do have control over your health. We can't stop aging, but we can be proactive. Consider food medicine to heal the body, address blood sugar imbalances, improve your heart health, your immune system, minimize inflammation, calm autoimmunity, balance hormones, make memories with your family and friends, live your best life. You want to enjoy your life. You want to not wind up in a nursing home where you're being cared for or your family has to care for you. You want to actually enjoy your life as long as possible and live a good, healthy, best life possible. So there's hope. You can reduce the harmful effects of stress and inflammation. To find out if you can have more energy, sleep better, become healthier, limit your need for drugs and surgery, take advantage of our complimentary discovery call. Everyone needs a coach. Even Michael Jordan, my favorite basketball player ever, he needed a coach too. So schedule your discovery call. If you'd like to, very simple. I have some envelopes here. And we have times that we set aside. All you have to do, take one of these envelopes, pick a time, and I will give you a call. If you pick a time, and we'll talk for, as long as it takes to discover whether you're somebody who I might be able to help. It doesn't cost anything. If you say, okay, that was a nice call, see you later, Dr. Markowitz, that's okay. But if I tell you that I think I could really help you, and you say, I'd like to help, then you go to the next step, which is a a consultation evaluation that really will spend an hour, and you'll really learn more about your health and how to improve it than I think you've learned maybe in your whole life. So, okay, I really thank you for being here. And if you want to schedule a time, come see me. And if not, that's okay too. But I'm glad I got a chance to talk to you. But I think it's a great opportunity. You have nothing to lose except a lot to gain. You change your life. Any questions? Okay.
Lyme disease, yeah.
Mm-hmm.
Neurological disorder.
Yeah, it's really a sleep disorder to some degree, neurological disorder. But again, we have to really figure out why you have it. I have to go through a history of when it started. Was there anything in particular at that time? Did you do anything differently? And what you've tried to do to help it also. So, I mean, you can have 5 people with the same condition, and there's 5 different causes. So we have to really figure out what your cause is. So I have to look at your overall health and ask you questions about that instead of just, I've got restless leg, just treat that. It doesn't work that way, and it's not successful doing it that way. But figuring out, taking away the factors that cause inflammation and stress, taking those factors away could really be very, very helpful.
Pills now, but I don't like the reaction.
Get off of them, or find out if there's an alternative. Schedule a call. I'd say I have nothing to lose. And you're taking stuff that's not making you healthier. You're taking stuff that's making you sicker. And I don't know if it's having any effect on your restless leg, is it? Mm-hmm. Yeah. Unfortunately, that's true with unfortunately, that's true for lots of medications. They work for a while, then you need a different one or more, and get rid of the cause. That's my message for today. Get rid of the cause. Any other questions? Okay. Thanks for being here. Anybody who'd like to schedule an appointment, I'm here to talk to you individually also and do that too.